Hello again. Here's some additional information about hepatitis B. Hepatitis B is a common disease in the United States. An estimated 800,000 to 1.4 million people in the United States have chronic hepatitis B infection. Every year, HBV kills approximately 2,000 to 4,000 people in the United States. Their death is usually a result of complications of liver disease. An individual's susceptibility to chronic HBV infection is closely correlated to the age in which they are infected. Only 5% to 10% of adults and children who are infected end up with chronic HBV. 25% to 50% of patients infected under the age of 5 will end up with chronic HBV. As much as 90% of infants infected with HBV at birth end up with chronic hepatitis B. Looking at the geographical distribution of hepatitis B, the sub-Saharan Africa and East Asia have the highest prevalence of hepatitis B infection in the adult population, ranging from 5 to 10% of the total population. The Middle East and India subcontinent have an estimated 2 to 5% of their population infected with HBV. In countries of Western Europe and North America, less than 1% of the population are chronically infected with hepatitis B. Diagnosis of hepatitis B is only possible through laboratory diagnosis. Acute HBV infections is identified by the presence of HB surface antigens and the immunoglobulin M, the antibody to HB core antigen. In early infections, the HBe antigen is usually found. High levels of this marker also indicate high levels of replication in the HBV virus. This indicates that the bodily fluids of this host are highly contagious. In patients with chronic hepatitis B, HB surface antigens is present in the patient for at least 6 months. The persistence of HB surface antigens for an extended period of time leaves the patient at risk for developing chronic liver disease and liver cancer later in life. Some individuals are at higher risk of obtaining hepatitis B infection than others. People who frequently require blood or blood products such as dialysis and recipients of solid organ transplants have an increased chance to exposure. People incarcerated into prisons are exposed to diseases from other inmates around them. Individuals who inject drugs may use dirty needles or share needles that are contaminated with HBV virus. Individuals with multiple sex partners can be exposed to all kinds of diseases unknown to them. Even healthcare workers can be exposed to the blood of an infected individual. Travelers to epidemic areas have an increase of exposure to HBV virus.